Hey guys, welcome to my channel. In today's video, we'll be speaking about all things postpartum, or mainly what people just simply do not talk about that happens during postpartum. Number 1, postpartum incontinence. This is simply known as you peeing yourself. So while you're delivering your baby, and this is whether you have a C-section or you have a natural normal birth, the muscles around your pelvis and your bladder are weakened. So because of this, you will not be able to control when you pee for a good couple months after birth. Or for some people, it could be just a few weeks. So what can you do to avoid this or even lessen the amount of weeks this occurs? You can do Kegel exercises. Kegel exercises are, I'm going to put a video to show because we're not getting on the ground. But these exercises strengthen your pelvic floor muscles, which support your uterus, bladder, small intestines, and even your rectum. And these exercises should be done during your pregnancy. Number 2, your stomach muscles can split. This is known as diastasis recti or divarication. This is normally seen when you either have a really big baby or you have multiple babies. Now, the separation varies in terms of size. When your baby grows, the womb grows with your baby, so it pushes the muscles, your stomach muscles, apart to create more room for your baby. But because of this, these muscles then weaken and become longer. But the good news is that after your baby is born, your muscles go back to normal. It does take a while, a couple of weeks. Google says 8 weeks. But after 8 weeks, your muscles will then go back to how they were originally. Look at the woman's body, period. Number 3, constipation and hemorrhoids. So for many moms, the first time they go to the bathroom after they have just given birth, it simply feels like birth all over again. Horrible. But this is true, and it can extend up to a couple of weeks after you have given birth. So to help you during this time, you must drink plenty of water. You can try eating some prunes. You must get lots of rest. That is near impossible because you literally gave birth, but it will help. Try to eat plenty of fruits, vegetables, whole grains, and you can take a laxative, but it is recommended that you contact your healthcare provider because your body just went through a lot. Putting more stuff may not always be the best. Now, on to hemorrhoids. Hemorrhoids are when you have swollen veins around your rectum. These veins are because when you're pregnant and you're getting close to your due date, your baby is then putting a lot of pressure onto that area. And this usually occurs for vaginal births. So symptoms are like you can have pain, swelling, itchiness around the rectum, or you may even have some bleeding after a bowel movement. Hemorrhoids normally go away on their own over time, but to help yourself out, because it can be a very painful process, you can give yourself a sitz bath, which is basically warm water in a basin and you sit in it, or you can just have a normal bath. This can help to shrink your hemorrhoids, and it is recommended to do 2 to 4 times a day. But again, you just give birth, so it can be very difficult. You can also get some refrigerated cool witch hazel and put it on a cotton ball and apply it to the area. You can also try to get some creams or some ointments. They are easily accessible over the counter at whichever pharmacy you would like to go to. But also try to increase your dietary fiber and drink plenty amounts of fluids. Number 4, afterbirth contractions. So when you have finished pushed out your baby, you have your lovely baby in your arms, you will still endure contractions, and unfortunately they may be as intense as the ones you have felt going into labor. Many moms say it gets really bad after they have just finished breastfed their baby. So you don't have to worry in terms of if you feel that this is not normal, if you have questions about it. It is normal, but unfortunately it is also very painful. Number 5, you are going to be extremely emotional and extremely exhausted. Constant mood swings are normal. Your hormones are not back to normal, they are all over the place. So, you in the first couple of weeks will begin to get annoyed from your husband that is really just trying to help, to even your sweet, beautiful little baby that is screaming for whatever reason. This is totally normal because, as I said, your hormones are all over the place. And unfortunately, lack of sleep does not help. You must try to get the most sleep you can. So, if you have help around, that would be crucial in this time. Please seek out help if you have family members that are willing to spend the night, to spend the day, so that you can get a couple hours of sleep. Postpartum comes with a mixture of emotions. Just because you had your baby, things do not immediately go back to normal. Unfortunately, postpartum depression is a reality. Some people call it baby blues, but in this time, it is critical to reach out if it's someone professional, if it is your husband. This is the time where mom friends are crucial because no one understands it more than someone that has experienced it. So you can reach out to your friends who have children of their own so they can help you out and understand where exactly you are coming from, because in reality this healing can take up to months or even years. Number 6, breastfeeding. So, breastfeeding is a beautiful time that a mom can spend with their baby, grow a wonderful connection, strengthen their bond. But breastfeeding is painful. It can even be extremely painful if your baby is not latched correctly. But even if they are, your nipples will still be sore because at the end of the day, your nipples aren't accustomed to having someone sucking on them. So it will be painful in this time. So ways in which you can help with the pain during this time is by nipple creams. These are great. You can reach out to your doctor to see the best ones, but you apply these during your feeding sessions. You can also try letting your nipples air dry because any type of touch can be irritating to your nipples because they just went through feeding your baby and they are extremely sensitive. You can also try applying gel. Put some gel on your nipple pads and put them on to dry nipples. Also, putting on nipple shields into your bras to stop your bras from having clothing irritation can also help. Also, you can apply cold compressions onto your nipples to help soothe the pain. Number 7, engorged poops. Yes, we all know that during pregnancy, your boobs are preparing to supply your baby with the nutrients that they need. But what we may not know is that your boobs can get engorged before your baby comes. And this experience is extremely painful. And also, whether you decide that right after birth you will breastfeed your baby or you will formula feed your baby, your boobs will still indeed get engorged and be extremely painful. So, for breastfeeding moms, you can use hot compressions on your boobs to relieve your boobs Either that or a warm bath can relieve your boobs and have a milk let down. So if you are planning to breastfeed, you can pump for when your baby does come, because the first set of nutrients in the first set of milk that comes down is more important. Y'all know what I mean. But if the baby is here, you can either nurse or you can pump. When you are finished breastfeeding or pumping and you're realizing that you're still having pain, you can apply an ice pack to the area. This will help to relieve the pain, relieve swelling, or even inflammation. You can also take doctor approved medication to help with the pain. You can also wear supported bras, put nipple pads in them to avoid you staining your bras and clothes with milk letdown, but wear bras which would support your boobs and keep them in place. So now for some more of the common ones that you would know. So you bleed a lot. You can't avoid it. Whether you have a natural birth or you have a C-section, you will bleed a lot. Obviously, if you have a C-section, it will not be as much as if you had a vaginal birth, but you will bleed. You can buy some Pampers or mesh panties and buy extremely large pads, because it will be like an extremely heavy period, even worse than that for a while. Of course, as the weeks go by, the amount of blood that comes will lessen, but be prepared. Another one is, we all know you don't literally just snap back after giving birth. After you have your baby and you leave the hospital, you will still look pregnant. Not the full 9 months, but you may look 5 months pregnant, 6 months pregnant. You still have a pouch that you would need to exercise and work down. Breastfeeding does help with getting down your stomach. So yeah, if somebody asks you in public if you are pregnant, don't be offended. It is normal. Postpartum shedding. This is another thing that happens to many moms. Normally is around the temple area. Many moms say that they have shedding. It can be all over or in specific sections. Your hair texture may also change. It will not be the same. Many things after having a baby will change. Your body will not look the same. Your skin may not feel the same. Your hair, your nails, but you just created the most amazing thing, a human life. So be patient with yourselves, love yourselves. You literally just created a baby. Props to you. You are amazing. You're doing great. Just make sure that you are doing the best that you can for your baby and yourselves. Anyone that has anything to say, ignore them, because you just created your baby and you're doing amazing. You're doing great. Keep pushing, and eventually, maybe even not, you may not get back the body that you previously had, but either way, you have an amazing body. Creating and having a baby is no easy task. Pregnancy in itself is not an easy task, and when your baby is here, it doesn't get easier. So in everything, just give thanks. I pray that if any of you that are seeing this video is currently pregnant, that y'all would have a beautiful and healthy baby. If you are in your postpartum period in your life, keep pushing, keep growing. You're doing a really good job. Give thanks to God in all things. And I thank you for watching this video. I hope you learned something new. Yeah, enjoy the rest of your day. Bye. Oh, like, comment, and subscribe.